black or white. It's not black or white. It's not black or white. It's not black or white. With Tim Stevenson and Diane Blakely. Not black or white. It's not black or white. With Tim Stevenson and Diane Blakely.
The body and the brain are not separate. Like it's all one.
All one.
And your spirit, it's all a part of your whole person. And that's the thing that we're trying to teach at the Samuel Institute is like, you're a whole person. You're not just a liver, or you're not just a heart, or you're not just the lung where you had the cancer. It's like you're the whole person that involves body, mind, spirit, family, culture, community. Everything goes into you. And in order to be well, in order to thrive, not just to be free of disease, but in order to thrive, you have to have the whole person engaged and healed, and untap that potential. And the mind has a very strong potential to heal. Right. Your body, it's not a surprise. We've evolved ways to heal ourselves. Like if we didn't, we would have not survived. Animals would not have survived if they couldn't heal themselves.
Right.
So like there are ways that the body has to tap into that.
Well, I know for me, that was one of the reasons that I chose UCI is because of that, because of the integrative medicine approach, because I felt like people are just looking at this one part of my body and they're not like addressing any of it. And then they give me a drug and give me another thing to be worried about, something else to be sick about in my body. And that does not happen at UCI. I mean, my doctor she's amazing. And she's like, well, this is what the picture holistically looks like. And, and she's not she's not treating me like parts, that's what I found so disturbing, and I think Western medicine has wonderful things in it, but I do think there is an aspect of Western medicine in particular where they don't include like your mind, body, and soul together, which I think UCI does. Now plug UCI because
UCI, go.
UCI, go UCI. Yeah. But no, I do think that they're doing, something different, and the biggest thing about it is, and I used to always say, I feel like Humpty Dumpty and no one could put me back together again. I would say it over and over to the point where I was like, oh, you need to stop saying that. But the thing is that place felt like they knew how to fix it all together again. So I was like, oh, they all the king's horses and all the king's men, they know how to put Humpty back together again, I really thought, and I've felt that way every time I have an appointment there. I feel that way. Still want to run into Dr. Dang. I never see him.
Yeah, he's busy.
He's a busy guy. But, I do think that, they're doing great things. Can you talk a little bit about the study, like how many people were in it, from point A to point B, because I know that you're involving Ambio. Am I saying it correctly?
Yeah, Ambio Life
Sciences, and how, because it's not legal here to practice it, the people in the study have to go to Tijuana to Mexico.
Yeah, so the study's ongoing. We're not done yet. Okay, we only have recruited 6 people so far that have had the Ibogaine. So we're looking at very small numbers so far. We hope to get up to 20 is our goal.
Okay.
We may stop early if the results are really strongly positive, but we'll see. So what happens is the Ibogaine, since it's illegal in the U.S., in order to sort of get treatment, is they have to go to Mexico. So in Mexico, Ibogaine's legal. And so there's clinics all throughout Mexico where people can get Ibogaine treatments. And the one that we partnered with is Ambio Life Sciences in Tijuana. So it's really kind of close to us, actually. And so one of the things that happened was I reached out to the clinic, and the director was like, yeah, well, we can just shuttle people back and forth from Tijuana to UC Irvine if you want to do your testing at UC Irvine. And we were like, that would be great because we can just scan their brains at UC Irvine. So what happens is patients that are addicted to opioids go to Ambio Life Sciences and get started on what's called morphine, which is an opiate, but it's more controlled and shorter acting and easier to use. So what happens is, like, say someone's addicted to fentanyl, so they're taking fentanyl daily, and they get put onto morphine instead of their fentanyl. So like they get transferred to morphine. They're still addicted. If they don't have the morphine, they'll have serious withdrawals. So that happens all in Ambio, in Mexico, in Ambio Life Sciences. And then they come up to UC Irvine for a baseline scan of their brain, and we give them questionnaires to fill out. And then they go back to Ambio and get the Ibogaine treatment, which, like we were saying, can last 2 days. And there's also like 2 or 3 days after that where they're kind of just recovering from such a.
Are they staying in the facility? Like they've got like a hospital?
It looks like a spa.
Oh,
like you're talking about. Yeah, it looks. I've been there, and it's really beautiful. It's a very nice space. They actually have 5 or 6 buildings that they're owned that like are all devoted to Ibogaine treatments, and one of them is specifically for addictions and detoxing. So that's anyway. I saw that building. They've got a pool, and they've got a hot tub, and they've got like a sauna, and they have excellent food and massage, and they do meditation, and it's close to the ocean, so people can go to the ocean.
Is that all happening when you're getting this drug?
Yeah.
So you could go relax. Wow.
Yeah, I mean, when you get the drugs, they have to monitor your heart pretty regularly. So they're on what's known as an EKG.
Oh, they are.
So they measure that while you take the Ibogaine, so they know that your heart's not having a bad response, right? And there's ways to recover and to abort if you have to, etc. So anyway, they get the treatment at Ambio Life Sciences, and then it's usually about 5 to 6 days later they come back to UC Irvine for another brain scan, which is their sort of acute, sort of shortly after Ibogaine brain scan, and then we fly them home to wherever that is in the U.S. We fly them home, and then 1 month later we fly them back and get them in a hotel at Irvine and scan their brain again. So that's a 1 month follow-up scan.
Okay.
Which is where things have settled down. They've recovered from, the experience. They've integrated it to some degree. They're more stable. And then we follow them for a 3-month and a 6-month follow-up of just questionnaires. And throughout each of these visits, we do a urine drug screen just to make sure
that they're not
on. Yeah, right. So it can see if they're on opioids or not.
Right.
So that's the design of the trial. And so, yeah, so far we've done 6 people.
And one person, I watched a video that you had sent to me, and she had struggled for a really long time to get off opioids. And
she was our very
successful. Right?
She was our very first patient, and she was addicted to fentanyl and crystal meth both.
Wow!
And she's
alive is a miracle.
She's now 7 months sober.
Wow!
She's been clean for 7 months now.
That's a big deal because, I mean, this kind of treatment can really change someone's life, because it was my understanding that she wasn't allowed to have her children anymore. I mean, this drug had caused such destruction in her life that it was reaching out to her children, So this is a big deal. You could really turn someone's life around and give them like a full regular life.
If you listen to her interview, she was abused as a child, like daily, and drugs were a way for her to cope. And after the Ibogaine, if you listen to what she says, she's like, after the Ibogaine, I no longer want to take drugs, and I forgive my abuser. I forgive the person that abused me, is what she said. And like that's a total cure,
right.
Of a whole total reset of the whole mental framework.
Right.
And not everybody has that dramatic of a response, but it happens with the Ibogaine. So
wow.
it's powerful for some people.
So if there's no other option, right? Like she's probably tried everything. I mean, that's a good option.
So like we were talking about Suboxone, like sort of 60 to 80% of the people will relapse after a month.
Yeah.
And that's if they're taking it Suboxone like daily for their medicine, and they'll relapse to like the street drug. Here she's 7 months, and
she's
it was
not
just
doing
one.
Any of that.
She had one treatment with Ibogaine.
So one pill.
Yeah.
Wow.
So one.
Well,
pill.
I don't know if it's like one. I don't know if it's like multiple pills within that, but it's like one treatment. So yeah, it's one session.
One session.
Yeah.
Because I find that so fascinating that somebody could spend their whole life doing, in her case, fentanyl and crystal meth, right? Is that what you said? And then you take just this very short little interval of a pill, and that could totally change the way that your brain interprets information subconsciously.
Right. Yeah.
That's what I think it's doing. It's making your brain interpret your subconscious mind that's usually so subconscious, right?
Right.
You don't know
That's
that you're
great, yeah.
thinking about that stuff.
That's wild.
It's
That's
really
amazing.
So do you plan with this kind of study to enlarge the study if the results are what you think they are? I mean, she's obviously a really great example of how that can benefit somebody. Do you think I'm actually going to say his name? Do you think that what Trump signed is going to allow for medical practitioners or certainly people that are studying the effects of psychedelics to expand that research, to actually fund it additionally from what it's being funded now?
So the state of Texas issued a statement and an effort a year ago to promote the study of Ibogaine in the state of Texas, and they
Why
donated
Texas?
$50 million to the state of Texas. Put forth $50 million
Oh, really?
to enhance the study of Ibogaine, and so that money's now working its way through the system, and people are now gearing up to do studies, and we'll find out maybe in a year or so, like how the results are turning out.
Will UCI get some of that money?
No, I don't
Darn,
think so.
50 million's a lot.
50 million is a lot. It would be nice.
Right.
What Trump said he would do is he would match that, like to have another 50 million. So there would be 100 million total that would be going towards Ibogaine research. But it seems like it's all kind of going to Texas. Like, I don't think it's going outside of Texas. However, there are studies, like with psilocybin, for example.
Mhm.
There's a lot of research in psilocybin these days, and the government is funding psilocybin research. There's
And
this
remind me what that
mechanism.
is again.
It's the magic mushroom.
Oh, okay.
So it's a serotonin.
Because
type
I have such a
system.
vast amount of knowledge about drugs.
You're like, oh, yeah,
The one person here who doesn't drink or smoke anything, I'm all, wait a second, I need a little help here.
magic mushroom. That's what they call it.
Yeah, it's on the street. Yeah, magic mushrooms.
Oh.
Yeah,
And that's being used in studies to help with addiction,
depression treatment, resistant depression, addiction, PTSD as well. So yeah, it's that the psychedelics, even though they come from like different places and have different structures and act on different receptors, a lot of them change the way the brain is wired. And we don't know exactly how it does this, but a lot of them have this what's called a neuroplastogen effect, where it causes the brain to rewire itself in certain areas. Normally that doesn't happen to this scale. Like normally when you go through your life, you'll have an event that you remember as a child, and like, okay, that like you fell off the bike and you really broke your leg or something, and that'll stick with you for your life. That plasticity that happened is just set in stone there, and that's not going to change, and that's there. What the psychedelics do is they rewire your memories, and they rewire the nervous system, and that plasticity is what it's called. Needs to be studied more. A lot of people are scared of that. Some people feel like the plasticity is too dangerous. Is it good plasticity or is it bad plasticity? And we don't. How does it know what to do? How does it know what's good for you?
So
Right,
microdosing, I want to ask you something about microdosing. So not to bring it around to my little episode a year and a half ago, but because I had such, and you know this, I'm like, oh, cancer, I'm going to die, that sort of thing. So my brain, whenever I see a story, gosh darn it, everybody on TV dies from that. I have like a little, thing that happens. So I did the EMDR therapy. I'm like tapping on my face, tapping on my chest, I look like a crazy person sometimes because someone will say something and I'll be like, oh, I need to tap myself or squeeze right here. But I thought, if I want to get rid of that, it is exciting to some degree, but what if you could microdose?
So
Ibogaine, and then I could reroute my brain. I really think it would be valuable to people, because I can tell you this. I follow a bunch of people who had what I had, and maybe worse, actually. And they all listen to me when I talk about the C word, cancer, PTSD. When I say that, they're like, what are you doing for that? And I was like, huh. So I think everybody who gets like a near-death experience, especially one that kind of lingers, because that's not like I'm having a death experience and then I'm dead. It's nothing like that. It's like I had a death experience and it's just like sitting there in the back, like in the back seat of the car, like waiting for you. That's how you feel about it. That's what a lot of, I think, survivors' brains work like. So I'm wondering, could they do that? Could they give a microdose of that, and then your brain, so that, because it gets in the way of healing, I think. If you're thinking, you're like nervous all the time, so you could microdose somebody who's had a PTS trauma, regardless of what the trauma is, and then their brain relaxes, and then their body can get back to baseline, right? Health.
So there's a lot of surveys that have been done for psychedelics, where basically you just mail out the survey, and if you happen to take psychedelics, you'll fill out the survey, and then that survey gets mailed back to the researcher. Nowadays, it's all done electronically, but anyway, it's the same kind of thing. So if you do these surveys, there's been 2 that have been global surveys, one in 2023 and the other in 2025. And Brock Plummer, a postdoc in my lab, has been analyzing that data, and interestingly, Ibogaine is one of the most common psychedelics to be microdosed.
Really?
Like a lot of people are using Ibogaine as a microdose, and I think that's probably because it's so strong. If you did what's called a flood dose, which is the 2-day journey, that's hard to do, and it's kind of dangerous as well. They think that, well, if I just do a microdose, that might be enough. So I think people are doing that now. Now there's no research.
How are they getting it? Not that I want to run out and get some, okay, folks?
Tijuana.
Yeah.
I was going to say, is that what
Right across the border. Yeah.
It's legal in Mexico.
Yeah.
So if you wanted to buy some in Mexico, you could and bring it back.
And you could go across the border with it, and you would
Well,
get
not
arrested.
legally.
Not legally.
Not legally. Yeah.
Oh, okay, I'm all like, wait a
Yeah.
second, folks, we don't want you to do that. But
Yeah, you can't
Okay.
do it legally.
Yeah. People were doing that before with other just opioids in general. Because
Really?
you could go to a pharmacy in Tijuana and buy 200 count of Vicodin without a prescription. So a lot of people were making that trip in the past 20 years just to have it on, because it was cheaper and you could just have it. Somas, all those things.
Yeah, for
Yeah.
sure, for sure.
interesting.
Yeah. So,
Well, I mean, I'm
but yeah, microdose, that'd be kind of cool, right?
well, I just think that, for people who are trying to get over things, I mean, I had a traumatic childhood too. So who knows? Maybe that's what would unlock. When you said that, I thought, if I did something like that, my brain would probably go and, try to fix some of that stuff, because I think, when you're an adult and you're, going about your daily life, you react differently to things when you've had personal trauma of any kind, I think.
Yeah.
You're more glitchy, you're a little more inclined to, my son goes, you don't need to raise your voice, Mom, because sometimes I'll be like, and I don't think that a person who didn't have trauma would be more inclined to do that. I think I got more like that after I had some trauma in my life. But
Yeah.
I think the world would be a healthier place if, I'm not promoting that everybody just run out and smoke things or anything, but I do think certainly for opioid addiction and for trauma like PTSD for service members, because I had a friend who, his husband, he had such severe PTSD that she kept a broom in their bed, and when he would have an episode, she'd hit him with it. And they did magnet therapy for him, and it was effective. The magnet therapy was working, but this sounds like it'd be way better. I don't know if he's still doing that anymore. She's no longer alive. She actually passed away, but I was really interested in that particular study because they were definitely looking at how the brain responds to trauma and the different colors. I guess the way that the imagery was, it would show like black space. Is that right? Black space where there's something where the brain's not functioning right, and then it's filled in white when the brain was okay. But it ended up being in color too, so you could see like the different way that the brain was responding. So it sounds like when they're doing the MRIs, you're looking at the brain like that, You know, I think when I read it, you talked about showing imagery to the patient.
Yeah. So what we're interested in is opioid addiction, and so one of the things you can do is show someone like pills or syringes or people administering drugs, like shooting up with heroin. You can show pictures of that to someone who's addicted to opioids, and it may trigger a craving. Like it triggers them to have more craving. And so one of the things we're doing in our study is we're showing these folks pictures of opioids, pills, and the needles, and we're looking to see what happens in the brain as they get more craving. We assess whether their craving increases with the pictures, and we're comparing that to neutral pictures, which are like pictures of working with nails or hammers or saws, and we're comparing the difference between those two pictures and looking to see how the brain is activated. And then we're seeing how that looks after they've had the Ibogaine to see if the pictures are triggering as much. Like someone who's gone through a trauma, if you see something that happened during that trauma can re-trigger that experience. And so that rekindles that neural pathway, which we think the psychedelics might be able to smooth out and rewire.
Gotcha.
So
of the 6 patients you have, are you free to comment on how many of them are having this positive reaction, like the patient that we talked about? I don't want to give up. I know there's HIPAA laws, so I want to be careful what I'm asking, So,
well, like I said with the buprenorphine and Suboxone, after a month, like 60 to 80% of the folks will relapse.
Okay.
So we've had much less than that in our study, much less than that in after 3 months and 6 months.
Really?
So, but again, it's small numbers and you can't really like statistically say a whole lot with it yet, but it's just enough to be really encouraging and just giving us the go ahead to keep doing this.
Do you have to, when you do a study like this, and I know that this one's funded, do you, once you conclude the study, right, you write your paper on the findings, are you going, if they're positive, right, and it shows a significant amount of success, are you going to make it a bigger study? Like, are you going to try to have a controlled, a placebo, portion of it?
Yeah. So this study was funded.
That would be super fascinating if you get it large enough.
This study is funded in part by the Etheridge Foundation. So Melissa Etheridge is funding.
I was going to ask you if it was Melissa.
It's Melissa Etheridge.
Yeah.
I met Melissa a couple of times. She's wonderful and very, very happy that she's helping us, and really think she's really a champion. And she lost her son from opioid addiction, and she just really feels like this is a calling, and it's something that she feels like the psychedelics are a way to heal this. And so I'm very thankful of her and for her foundation. And then we also have funding from the Samuel Institute at UC Irvine that's giving us some money to look at how Ibogaine is working. But yeah, once the study is done, irrespective of whatever we find, we're going to try to publish it. Okay. Even if it's negative, we're going to publish it because we need to know if these things are working or not. Right. And I'm not about just putting something out there if it's just positive, because that doesn't make sense. Like, I want to show the data and let the data tell the story. So so there's that. But I'm also interested in adapting this trial as it's going. And one of the things that I was thinking of doing was, after folks have the Ibogaine, I'm very interested in giving them rehab, because I think the Ibogaine's not, I don't think Ibogaine is the only thing that needs to be done. I think people still need some assistance. Some people do after they've had the Ibogaine, so that they can reintegrate the experiences to get back into regular life. Exactly. And so someone who's been addicted to like fentanyl for say 20 years, and is taking fentanyl daily, like, that's hard to undo. It's hard to fix. I think Ibogaine's great. It's very powerful, but I think rehab on the back end would be very helpful. And we do this with things like psilocybin and other psychedelics anyway. There's like psychedelic-assisted therapy. There's therapists which are trained to guide you back into the integration of that spiritual experience that you had with the psychedelic. How do you reintegrate that with your life? and then how do you get back into society and thrive?
Are you looking at
So-
when you say rehab? Are you looking at stuff like 30-day housing facilities? And the reason I ask is because we're going to have a conversation with a young man next week, a week from now, when he returns from Hawaii, who has started all of these 6-month programs. So there's 30 days, right? So he contracts. He's 29 years old. He had a very serious drug addiction, and he turned his life around. And COVID helped him do that because of the isolation that happened during COVID, and he got sobered in a jail. But I will save the rest of that interesting story for when he talks. But ultimately, he found a hole in the system where, you know, these people who come off these, you know, intense drug addictions have 30 days to kind of make way with it. And then after that, they're out. And he's like, he felt that there should be something longer, like a 6 months thing that helps people integrate, get jobs, learn how to get back into society and stuff. And I thought, wow, this is really fascinating, because I just assumed, because I'm so naive when it comes to drug usage in general, I didn't know that they were like 30-day per. I assumed when you came off something like that, you were in there for like a year. I really did think that, but that was not the case. There was a
You know, the one patient that we were talking about in our study that you brought up that was interviewed, she went to rehab after the Ibogaine.
Oh, she did.
Yeah, and I think that really helped her as well.
Okay,
I
did
think
she
it
do
was helpful.
30-day thing, or
She
was
did-
it longer
she
than
did
that?
Longer. She did
Okay.
longer, I think. You'd have to. Yeah, I don't want to talk much about her.
Right,
But like,
of
yeah,
course.
she did a lot, and I think that did help. I think it did help.
Yeah.
And interestingly, Orange County is the highest ranking county in the U.S. for density of addiction rehab facilities.
Yeah.
I
think I told you this once. My
Yeah.
friend owns 3 wellness centers.
Yeah,
Newport, Costa Mesa. Right?
yeah.
I just,
Everyone comes here.
Yeah.
Everyone comes here for their drug addiction.
Mm-hmm.
Yeah. And what happens is folks come here and they either, their drug addiction ends and they just stay and stay in Orange County, or they don't get, the addiction doesn't end and they stay and they're, addicted in Orange County. So it's,
they stay. They're
it's like-
addicted in Orange County.
they stay.
Yeah,
It's
like,
true.
Yeah.
It's true. Cause they may not have money to go home, or,
Right.
they may, so
You gotta
anyway,
have some money to be here.
I think this is
There's
something
a
for
lot
Orange
that
County.
don't. It's crazy.
Really?
It's expensive.
You'd
It's
be amazed.
expensive.
Yeah.
Yeah.
That's why there's a homeless problem. Like when I lived in Newport on Superior, homeless everywhere.
Is that
It's
still the case?
borderline Newport Beach, right? They would just come out of the woodwork and they would go to the food bank and then they would disappear, but they were everywhere in the county.
Huh.
Yeah.
Interesting.
Exactly. Yeah.
Yeah.
So
Wow.
if we want to make a difference and try to reintegrate folks,
Mhm.
help, this is the place to do it. This is the place to
Well,
do this type of work.
Yeah.
If there's been 50
Yeah.
million given to Texas, and the Trump administration is going to offer another 50 million,
Yeah.
which bravo, I think that's a great idea. They should disperse it. And if we're the highest concentration area for
You know what I
drug
want?
addiction, they should send it to Orange County. He
Yeah.
likes Orange County, by the way, too. So
He doesn't
What
like
I
the
want-
state though, right?
Yeah.
Yeah.
What I wanted to do was, have you heard of the Sackler family? So these are the folks that basically got us all addicted to opioids. So the Sackler family is this very rich family that headed Purdue Pharma, which basically had the patent on OxyContin. And
Are
so
these
what
the
happened
two
was,
brothers?
yeah,
I saw that. I saw a movie about that.
yeah. So
Yeah,
there's
yeah.
one like drug sick or dope sick,
Mhm.
and then Anyway, it's a fascinating story, and it's horrible what they did, but they ended up getting a lot of people addicted to opioids when they didn't need them for pain,
Mhm.
and that's what started a lot of this epidemic that we have.
Mhm.
What happened in the early 2000s was doctors would give patients for surgery, they'd give them a lot of opioids when they left because the doctors didn't want the patients to call back and say, I'm in pain.
Right.
And the doctor didn't want to have to deal with that. So the doctor gave them a lot of opioids. And then the patient heals, the opioids end up staying in the medicine cabinet,
Mhm.
and then the teenager kid comes by and
So
ODs.
I think we discussed that too,
Mhm.
because it
ODs
used to
on
be a
opioids.
running joke when I was right out of high school, right? That if you wanted a pain pill, you would ask the soccer mom,
Yeah,
right? Because
Yeah.
they've all like had a surgery or have had something, and they always had pills.
I had a whole
Yep.
bunch of those because I never used them. So when I've had surgeries and stuff, they've always given me an opioid, but I've never taken it
So
because
it's-
I was afraid that might happen.
the Sacklers were devious in that it's addictive. So when you take an opioid like OxyContin,
Mhm.
long term, you get addicted to it. So then you need more of it, or else you'll feel bad. And then you end up eventually no longer taking the opioid to feel good. You're taking it to not feel bad. And you feel horrible when you're not taking it. And then you just transition from the pill to heroin to then fentanyl, and then it's over. So anyway, this happened, and the Sacklers have been fined, and a lot of their money has been dispersed throughout the states
Wow.
to combat this epidemic, to combat this problem. And that's actually something that I wanted the California state to use some of that money that they got from the Sacklers, that the settlement had come. I was hoping that we may be able to use some of that money for treatments like Ibogaine and the research into that stuff
Can
to
you
help.
get access to that?
No, like apparently none of
You're
the
like, no.
yeah, none of the it's called the opioid settlement funds, or so none of the opioid money that was delivered to California has been used for research and new treatments like Ibogaine.
What has it been used for?
It's more used for like educational programs or rehab facilities as well, like other like buprenorphine treatments, like the treatment that we were talking about where they get addicted to another drug that's another opioid, and so trying to rework those types of treatments into the system. So
It's
anyway,
a little unfair. I mean, I think it's great to educate people, but to actually practically apply it to make people better would be, I think, a little bit. I don't know. Call me crazy. It sounds better to me, but to actually apply it
Right.
is something.
Our current treatments don't work. Like our current
Right.
treatments for opioid addiction are not.
They're not
They're not as
effective.
effective as we need them to be. They just mask the addiction, and they're not quite good. They're not very good at that either.
It's not black or white. 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 With Tim Stevenson and Diane Blakely. Not black or white. It's not black or white with Tim Stevenson and Diane Blakely.